Oocyte banking or egg banking, very trendy situation today. Now, who are the people who actually need oocyte banking? Now, number one, undisputed, is those who are going in for cancer therapy, because many of them, they are not married, many of them are married, they have no children, many of them have one child and would like to have another child. So before they start their chemotherapy or radiotherapy, which destroys the eggs, it's very important to collect the eggs and preserve them. And we have protocols which are called random start protocols, which means you don't have to wait for the periods to start. You can start stimulating at any time of the cycle. And this is something which is identified about 4 or 5 years ago. And you can collect the eggs by, all you need is about 10 to 15 days time to actually stimulate the ovaries and get the eggs, freeze them, or create embryos if they're already married and freeze the embryos. Now, the other category who need egg freezing are those with endometriosis, and this category, they don't want a baby now, but later on they will plan for a baby. So you collect the eggs, and if they are married, you create the embryos. If they're not married, once again you freeze the eggs. So this is another important category, and the most important category are those who are over the age of 37 or even more than 35. You do an antral follicle count and you do an anti-Mullerian hormone evaluation, and if you find that the reserve is low, it's very important to advise egg freezing in these women because of their career or because of other problems. They are not able to decide on a marriage immediately, but it's very important for them to freeze their eggs so that they will be able to use their own eggs to have a baby. And the most important of all are those who have had multiple surgeries on the ovary. Once again, their reserve is low, and when the reserve is low, then it's better to freeze the eggs. Now, a very strange situation we are seeing in our practice today. Normally, low reserve is seen in patients over the age of 35, but today, surprisingly, we find that at least 20% of women we see with low ovarian reserve in ages as low as 25, 26. It's very, very surprising. We never used to raise AMH as a part of our general investigation protocol before, but today AMH forms part of our investigation protocol because you find so many patients who have a low value, and because they are young, you don't even suspect that they have. So now all ultrasounds are done with measurement of antral follicle count, and we do anti-Mullerian hormone to identify these patients early so that we can give them the right choices and options for their reproduction.